TOA. Years helping people, and hopefully this new orthopedic surgeon. Well, I take that back. If payment and educational purposes only. If you have a problem, you need to seek out care, please give us a call or go onto our website, www.toa.com, and we can get you some help, okay? So let's talk a little bit now about our latest topic.
Sorry.
Are we not working?
It doesn't look like it. Can you guys check your feed? It does?
We're checking. It could be a technical issue. For those of you not in Nashville, it's freezing here.
It's showing.
Winter has come.
Okay.
Are you guys ready?
Yeah,
you guys
sorry.
okay? Do you think we're okay? We don't know. It's the interwebs. We don't know if it's going out there or not. Okay. So looks like we're all going. Thank you. Looks like it's all going. So after last episode, which was about disc herniations, I realized that I probably should have put today's topic first, so that we can kind of get a little bit of groundwork about a little bit more detail. So today we're going to talk about sciatica. Sciatica is a symptom. Sciatica just is simply nerve pain going down the leg. But there's a lot about sciatica that we need to know about that just doesn't mean a pinched nerve. And so I thought we'd talk about that, and that way we can kind of tie in the first episode, which was acute low back pain, the last episode, which was disc herniation, and then today's episode. So let's see if we can talk about sciatica a little bit. So again, what we're going to talk about today is sciatica. We're going to talk about what it is, what it's all about, what are the causes of sciatica, how is it diagnosed, how is it treated, and so forth. So first, I want to give you a little bit of an anatomy lesson, or a little bit of pearl of wisdom. Let's talk just a little bit about what nerves are. Nerves are basically electrical wires in your body. They transmit signals back and forth from various parts and do certain things. They don't think, they don't make decisions, but they help our brains understand what's going on with our body. So nerves kind of have effect on several functions in our body. They allow us to feel, so things like touch, pressure, vibration. They allow us to feel pain. They transmit pain signals. They operate muscles, so when your brain says, make my hand grab, the muscles that make my hand grab move. They operate the reflexes, you know, when somebody bangs you on the knee with a hammer at the doctor's office and your leg flips up, that's a reflex, and that's run by nerves. And then lastly, the nerves kind of work in the background to give the brain information about what's going on. So they're kind of like a network of sensors to tell us all the status of the body. Where is my body in space? How fast am I moving? Does that hurt? Are things working correctly? So there's a big network of nerves in the body that works on that. Nerves are complicated. Nerves are fairly well understood, although they're not universally understood. One thing we do know is nerves don't like pressure on them. Nerves don't like inflammation. Nerves don't like stimulation. And so sometimes nerves can go crazy and send off signals even without a problem such as something pushing on them, okay? So the sciatic nerve is the biggest nerve in the body. It's basically made up of several nerves coming out of your lower back, runs down through your pelvis. This model here is kind of a cutaway. Your pelvis would be around here in the front. So here's your spine. We've seen this in our other videos. These guys are the nerves, the yellow things are the nerves. And this cutoff piece is the sciatic nerve, and it's made up of several nerves in the lower back. Most importantly for me is the L5 nerve, which comes out here at the bottom, and the S1 nerve, which comes out below. And it comes together and then runs down through your buttock area and down your leg. And that nerve, big rope, it's about the size of my thumb sometimes, runs down to your leg and runs the muscles and nerves, the sensation and stuff down in your leg. So that's the sciatic nerve. Sciatica just means nerve pain associated with the sciatic nerve, okay? So some people will come into the office and say, oh, I have sciatica, and they point to their back and they have no signs of nerve pain. They really say it's sciatica. I have a pinched nerve in my back. Well, that's not truly sciatica. Sciatica actually is the nerve pain that goes down to the hip and leg, okay? So a little bit of detail there. So there are a number of reasons why the sciatic nerve can give us problems. Most commonly, it's pressure, compression or pressure on the nerves. Like I said, nerves don't like being squeezed. And that pressure can come from the back. So things like the disc herniation we talked about last time, where part of the disc is pushing on the nerve back in the spine, and it pushes on one of the nerves that makes up the sciatic nerve, and we feel that down the leg. Sometimes it can be pressure on the nerves outside of the spine. The two most common things we see of sciatica caused by pressure outside of the spine are in pregnant women. When a pregnant woman, here's her belly out front, the baby lies inside the belly. The baby can lie down on the sciatic nerve and cause pain that runs down your leg. That's one very common one. As the belly gets bigger, the weight gets more, and the sciatica pain can get worse. The other is where the sciatic nerve runs down out of the pelvis, out of the hips, down through and underneath the buttock muscles that go down and then ultimately goes down in your leg. Many times we'll see sciatica type pain or nerve pain coming from pressure around the buttock muscles. So for example, people who get a lot of sciatica because they sit, sometimes it's related to the fact that the sciatic nerve is getting squeezed between the bones of the pelvis and the muscles of the buttock. Runners, cyclists, people who are endurance athletes who do a lot of training where their buttock muscles are really firm and really tight can actually get the muscles so tight that it squeezes on the sciatic nerve. That's actually a problem called piriformis syndrome, where the piriformis muscle, which is one of the buttock muscles, gets so tight that it actually pushes and squeezes on the sciatic nerve. And so that can give you sciatica down the leg without actually pressure coming from the back, okay? Occasionally people can have a stretch injury to the sciatic nerve. They get jerked around or pulled, and that can cause sciatica nerve pain. Rarely people can have a tumor of the nerve that can cause sciatica nerve pain. But the most common we see are the two, the pressure on the nerves coming from the back and then the pressure on the nerves outside in the buttock area. We're going to kind of concentrate on the lower back part. Usually the piriformis syndrome is treated predominantly with stretching and activity modifications, taking the pressure off. It's a management strategy. It's not something that we can necessarily cure in the endurance athlete because those muscles are still going to be tight. But if we can balance their muscle strength, loosen their hamstrings, stretch their buttock muscles, stretch the piriformis muscles, we can take the tension or the pressure off the sciatic nerve and make it feel better. There are rare circumstances where that piriformis will be released surgically, where they take it off. That's pretty extreme, so we don't really talk about that. So in the lower back, basically pressure can come from a couple of different sources. As we talked about last time, if you didn't see that video about disc herniations, you can go back onto our Facebook page or the YouTube page and look that up. We talked a lot about disc herniations and what those are, but basically it's pressure pushing on the nerves coming from the disc itself. That's probably the most common thing we see in the younger population, 20 to 50-year-olds, where that disc breaks down, starts pushing on the nerve, puts pressure on one or more of the nerves in the lower back that goes down the spine. And then in the older population, middle-aged and older population, so kind of 40s on up, we start seeing arthritis develop in the joints of the spine, The joints get larger because calcium builds up around those joints, and the little holes, these guys here, where the nerves come out, tend to get smaller, and that can cause narrowing around where the nerves are and cause sciatica symptoms. That's a problem called spinal stenosis. We're going to talk about spinal stenosis and treatment in a later episode. But basically, the compression problems in the spine typically are either a disc herniation or spinal stenosis or a combination of both. Both of them can cause pain. Again, the brain can't differentiate where the irritation of the nerve is. It can just feel it along the nerve pathway and interprets it. It's up to us to kind of figure out where the problem is. Fortunately, because the nerves that run down from your back down your leg follow fairly consistent pathways, we can kind of get a very good idea of which nerve is being bothered by the location of the discomfort. Usually the discomfort is described as sharp pain, burning pain, pain that kind of runs in a pathway. People will describe a path down around their buttock area, down most commonly either into the side of the leg down to the foot and calf, or down the back of the leg to the foot and calf. Those are the two most common areas we see with sciatica. People can have nerve pain in the leg addressing other nerves, but those typically are the two nerves, the side of the leg and the back of the leg, that are associated with the sciatic nerve. There's a nerve that runs in the front of the leg called the femoral nerve that serves a different area, and it's made up of different nerves, and that's kind of a different, similar but different source. Sometimes this pain can be constant, sometimes it can be alleviated with certain positions. Many times sciatica is increased or aggravated with sitting. Usually it's sitting either puts direct pressure on the sciatic nerve, or when we sit, the body gets shorter, it squishes down, and that space for the nerves gets smaller, okay? And so sitting is a very common reason why, or a complaint that people have that they can't tolerate. Oftentimes getting up, moving around, changing position helps to make them feel better. Sometimes lying down flat on their backs in particular helps make them feel better. The sciatica symptoms coming from spinal stenosis are commonly associated with standing and walking, and the classic symptoms get better if they can sit down briefly. The reason why that is when you stand up, your back has to arch backwards. What that does is narrows the space for the nerves if the holes are small, if you've had that stenosis. And when you sit down, you tend to bend forward a little bit, and that takes some of the pressure off. So that's a little bit in the history, what the patient tells us. That's a little bit about how we can kind of decide why somebody has this problem. Okay, so how do we diagnose it? First off, it's the medical history. It's what they tell us. What happened? How did it start? What makes it worse? What makes it better? What location the pain's in? And then we examine them. We can see if they have loss of sensation or reflex changes or what are called nerve tension findings. There are certain times we can stretch the nerve and reproduce the pain. That basically puts the nerve on stretch and stimulates it more, and that stimulation can reproduce their pain. And then sometimes they have muscle weakness according to the pathway of the nerve that's involved. The last thing we do to try to help make a diagnosis, so we've kind of suspected what's going on, we suspect what nerve is being bothered or nerves that are being bothered. We kind of get an idea by the history and the examination of which nerves are being bothered, and then we get pictures. X-rays can be a little bit helpful. We always get X-rays to make sure we understand the bone structure. It can give us an idea if there's slippage of one bone forward on another, for example, or a fracture or tumor or something like that in the bone. A little bit of arthritis, and then an MRI is often the most helpful because that really gives us the three-dimensional view of the spine so we can see how much room there is for the nerves and where the nerves are getting squeezed. Again, the sciatic nerve is made up of multiple nerves. The most common two nerves that we have problems with in the lower back are L5 and S1. They come out at the bottom two levels, and they're affected by the bottom two levels, which are the most commonly problematic areas in the lower back. So, how do we treat sciatica? Well, it depends a little bit on how long it's been going on, what's causing it, whether it's a disc herniation or stenosis or just compression because you're sitting on your sciatic nerve. And so typically if it's relatively new onset, we'll start treating it with some physical therapy. We'll use some medications like anti-inflammatory medicines, Advil, Aleve, or prescription strength anti-inflammatory medicines. We may use steroid medications, which are a different type of an anti-inflammatory medicine, to try to reduce inflammation. Some people will use medicines such as gabapentin, Neurontin, or Lyrica. These are medicines that can help control nerve sensitivity, and we use them oftentimes on the short term to try to relieve people of acute nerve pain, or sometimes we use these medicines long term for chronic nerve pain to try to, what I tell patients is we're trying to decrease the sensitivity of the nerves. They act on nerve pain, but they're not opioid pain medications. It's a different type of pain. They are, however, treated like opioids with regard to prescribing, because they do have some addictive qualities and some side effects like drowsiness and being groggy and spacey feeling. But they can be useful. Depending on if we believe that there's a problem with nerve compression in the spine, either stenosis or disc herniations, and the other things have not helped, we may try what's called an epidural steroid injection. It's a cortisone shot into the spine. Steroids is a cortisone is a generic term for a steroid, which is a type of anti-inflammatory. And what we're trying to do with that is reduce the inflammation of the nerve that's caused by either the mechanical pressure on the nerve, or in the case of a disc herniation, when that chunk of disc pushes out and pushes on the nerve, it actually causes a chemical irritation of the nerve as well. And so we're trying to reduce the inflammation that's the result of either the mechanical pressure or the chemical irritation of the nerve. The good news about sciatica, whether it's caused by just pressure in the butt muscles, stretching, or even pressure in the spine, is many times people get past it. It can take 6 to 12 weeks, sometimes even longer, to get rid of it, but we probably estimate 80 to 90% of people who come up with acute sciatica, recent onset sciatica, it'll settle down and get better as time goes on. Now, sometimes it comes back, particularly depending on what the cause of the problem is, but many times we can get it better. So sciatica by itself is not necessarily a problem that needs surgery. In fact, most of the time we can get better without surgery. Now, where does surgery come into play with sciatica? If there is pressure on the nerves in the spine, such as a disc herniation or stenosis, these types of mechanical squeeze on the nerve, where we can remove the squeeze, that's where surgery is helpful. And so depending on the cause of the problem, the source of the problem, it changes what kind of surgery we do. But in simple terms, surgery for sciatica is meant or designed to take the pressure off the nerves and give the nerves more room, okay? Like I said, sciatica pain related to the piriformis in the buttock muscle is typically not a surgical problem. It's a stretching and therapy problem, although there have been occasional times when people have released the piriformis muscle to try to make more room for that nerve, and has helped some. I don't have any experience in that personally. Some of my partners have done a few of those. It's pretty rare. So usually, particularly in the athlete, the piriformis syndrome, the squeeze because of the muscles around the buttocks, are treated with stretching, modifying activities, anti-inflammatories, no surgery, okay? So, this has been kind of a short visit today. We've talked about sciatica, the nerve pain coming down from your back and into your leg typically. We've talked about what it is, what can cause sciatica, how we diagnose it, again, listening to the patient and history, physical examination, x-rays and imaging studies, and then we talked a little bit about treatment. So I hope this has been a helpful little discourse about what sciatica really is, what it means, and giving you some good news that most of the time we can manage it. I will say that there is an entity of chronic sciatica, which means that it's constant and we can't get it better. Sometimes the reason why that occurs is because there's been permanent biological changes to the nerves Nerves aren't really wires. They're actually cells that communicate chemically, but they act like wires. But what can happen is the biology of the nerve can change where that cellular chemical communication pathway is damaged and they can't send the appropriate signals, or they send off random, unpredictable signals. And the brain interprets that, since the nerves can't think for themselves, the brain interprets that as best as it can, and basically people feel pain due to chronic damage to a nerve. That doesn't just happen in the sciatic nerve, it happens in all nerves potentially. And so some people can develop chronic damage to the nerves, which can lead to permanent symptoms. The trouble there is you can take the pressure off the nerve, but if the nerve has been permanently damaged, I can't restore that or reverse that process. And so there are people who have chronic sciatica, even if they've had surgery, and we don't have much further to do for them. That becomes a pain management problem, and that's typically managed with medications, injections, and then in the extreme case, people will undergo technology-based treatment, such as what's called a spinal cord stimulator, where an electronic device is implanted into the spine to try to confuse the signals getting to the brain. And basically we trade one type of sensation for the pain sensation to try to help manage the symptoms. I think we'll probably get into chronic pain management and those types of technologies in a later episode. Anyway, so that's it for today. I hope this episode number 3 of The Doctor Is In Live with TOA has been helpful to you. As always, please feel free to communicate with us, give us ideas about topics you'd like to discuss, give us information and criticisms about how we can improve things. Again, this is only episode 3, so we're still new at this stuff, so we're trying to figure it out. But we want to make it a good experience for you. Come to TOA.com, that's www.toa.com. You can learn more about our practice, all the physicians in our practice, our locations, our services. You can even set up an online appointment with that. You can certainly go to my website, which is Dr. Stahlman online. That's DrStahlmanonline.com. That's a website that I created for myself. It's got a lot of paper information regarding these various topics that I give to my patients. Feel free to email me if you have questions. My office email is stahlmangc, STAHLMANGC @TOA.com, or info@drstahlmanonline.com. Both of those go directly to me. Hit us up on the Facebook. Whatever other social media you guys like to do. Look at me, I'm old, I don't know all this stuff. But it's pretty cool. I hope this is a technology that you like. What is our next topic? I have a whole team here, by the way, that's helping. Sorry.
Spinal stenosis.
And when is that?
Next Friday, November 15th.
Next Friday, November 15th, noon Central Time. We'll talk about spinal stenosis. It'll give you a chance to entertain while you're eating your lunch, or while you're waiting to watch Young and the Restless. Sorry. Anyway, enjoy your weekend. Stay warm if you're in Middle Tennessee. Go out there and live your best life.